Lopid, also known as gemfibrozil, is a medication that is used in combination with a healthy diet to lower fats, specifically triglycerides, and increase good cholesterol, HDL, in the blood. It may also help to decrease bad cholesterol, LDL. Lopid is classified as a fibrate drug and works by reducing the amount of fat produced by the liver. Lowering triglycerides in individuals with very high triglyceride levels can reduce the risk of pancreas disease, also known as pancreatitis. However, it may not lower the risk of heart attack or stroke. It is important to speak with your doctor about the risks and benefits of taking Lopid. In addition to following a proper diet, other lifestyle changes that can help Lopid work more effectively include regular exercise, reducing alcohol consumption, losing weight if overweight, and quitting smoking. It is important to take Lopid as directed by your doctor and to follow their recommendations for the best time to take this medication and the appropriate daily dosage. When taking Lopid, it's important to follow your doctor's instructions. Typically, you'll take this medication by mouth twice a day, 30 minutes before your morning and evening meals. The dosage will be based on your medical condition and how you respond to treatment. If you're also taking other medications to lower your cholesterol, like cholestyramine or cholestyramine, make sure to take gemfibrozil at least 1 hour before or 4 to 6 hours after taking these other medications. This helps to prevent any potential interactions. To get the most benefit from Lopid, it's important to take it regularly at the same times each day, even if you're feeling well. Most people with high cholesterol or triglycerides don't feel sick, so it's essential to keep taking the medication as prescribed. In addition to taking Lopid, it's crucial to follow your doctor's advice about diet and exercise. It may take up to 3 months before you start to see the full benefits of this medication. Remember to always consult with your doctor before making any changes to your medication or treatment plan. Some common side effects of Lopid may include stomach upset, stomach/abdominal pain, or unusual taste. If these effects persist or worsen, it's important to notify your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they believe that the benefits to you outweigh the risk of potential side effects. Many people taking this medication do not experience serious side effects. In rare cases, Lopid may cause gallstones, liver problems, and muscle problems. If you notice symptoms such as nausea/vomiting, severe stomach/abdominal pain, yellowing of the eyes/skin, dark urine, muscle pain/weakness, or signs of kidney problems, it's important to seek medical attention immediately. Additionally, it's crucial to contact your doctor if you experience signs of infection, easy bruising/bleeding, unusual tiredness, irregular heartbeat, numbness/tingling of arms/legs, or symptoms of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, it's important to consult your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Lopid, make sure to inform your doctor if you have any allergies to gemfibrozil or other fibrates like fenofibrate, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have liver disease, gallbladder disease, kidney disease, or if you consume alcohol. If you are planning to have surgery, let your doctor or dentist know about all the medications you are currently using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor as Lopid may harm an unborn baby. Breastfeeding while using this medication is also not recommended, as it is unknown if the medication passes into breast milk. Be sure to consult your doctor before breastfeeding. It's important to be aware that Lopid can interact with other medications, potentially changing how they work or increasing the risk of serious side effects. This is not a complete list of all possible drug interactions, so it's crucial to keep a record of all the products you use and share it with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Lopid include lisinoprevor, blood thinners such as warfarin, colchicine, repaglinide, and statin drugs such as atorvastatin, levastatin, and simvastatin. It's also important to note that Lopid can slow down the removal of other medications from your body, which may affect how they work. Examples of affected drugs include daprodustat, elagolix, irinotecan, pioglitazone, selexipag, and a certain combination product used to treat chronic hepatitis C, ombitasvir/paridaprevir/ritonavir/dasibuvir, among others. Always consult with your doctor about potential interactions and the best time to take this medication. If someone has taken too much Lopid and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It is important not to share Lopid with others. You may need to undergo lab or medical tests, including cholesterol and triglyceride levels, kidney and liver function, and complete blood count while taking this medication. It is important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Lopid, take it as soon as you remember. If it's almost time for your next dose, skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. When storing Lopid, it's important to keep it at room temperature and away from light and moisture. Make sure to keep it out of the reach of children and pets. When it comes to getting rid of any leftover or expired medication, it's best to consult with your pharmacist or local waste disposal company. It's important not to flush Lopid down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.